Hey everyone, and good afternoon, and welcome to our second part of our stroke awareness series and Ask an Expert. I'm really excited to have Wendy Camp with me. She may look familiar to you as she's been with us before. She is the director of our stroke and telehealth stroke program and also a nurse practitioner, and she's been working in the field for several years. So Wendy, thanks so much for joining me today. Excited to have you back with us.
Yeah, thanks for having me back. I appreciate it.
Course. And so today we're going to be talking a little bit more about those stroke risk factors, specifically the ones that we can modify. We'll touch again on the ones that, we don't have as much control over, but I know last week we talked, just briefly over what a stroke is, those risk factors, but I'm really excited to get into this with Wendy. She's a wonderful expert on this and can tell us a lot of what we can do to help with preventing strokes for ourselves and maybe even some information to pass along to our family members. So awesome. So Wendy, could you start us off with kind of going over modifiable risk factors of a stroke?
Yeah, so like Jean said a few minutes ago, there's a lot of risk factors that you can't control. But in actuality, probably 80 to 85% of strokes are actually preventable by either preventing or, treating the risk factors that do lead to stroke. And so this is, something I'm really passionate about, just, being able to educate my patients and even my own family members about what they can do to mitigate or reduce that risk of stroke over the long run. And stroke risk factors are very similar to what you would see for risk factors for heart disease and heart attack. It's all kind of the same process happening in different parts of the body. And so the good news is modifying these risk factors will also reduce your risk for heart disease over time, as well as even things like cancer and sometimes even things like memory loss and dementia. So, this is it's really good information, and it's really important to control these things as early as possible, so that we can prevent those long-term, the bad outcomes in the long run.
Mm-hmm.
So, I mean, the big ones, it's kind of the big four, right? So it's high blood pressure, high cholesterol, diabetes, obesity, and then there's some other things that are more lifestyle related, like tobacco use and even illicit drug use. And then the other thing is even things like obesity. So our activity levels and our diet are an important part of preventing, these illnesses and chronic conditions.
Yeah, absolutely. And so I know we're going to go over each of the chronic issues, like you said, hypertension, diabetes, obesity, those sorts of things. But how impactful can modifying these risk factors be in preventing strokes?
I mean, it's huge. And hypertension is probably one of the biggest causes of stroke, one of the biggest causes of heart disease. The thing with things like high blood pressure is they change the way that your blood vessels work, and they change the way that the inside of the lining of your blood vessels looks and the type of tissue that's there. And things like smoking also do that. It's really important to control those things to prevent the damage that's happening on the inside of your blood vessels and your organs, to prevent these diseases in the long run. And it's, again, we sort of quote this a lot, but 80% of strokes are preventable. I mean, that's a really big number, and it's good news, right? So if you've got family that have had strokes, you can't fix that, but you can fix the things that also tend to run in families, which are, again, diabetes, high blood pressure, high cholesterol. All of that's very treatable. Some people have difficult to control high blood pressure and high cholesterol, and difficult to control blood sugars, but for the majority of people, those are definitely modifiable risk factors. And it's not what I call like a total sum game, right? You don't have to be perfect in all of those areas to reduce your risk. And so obviously we would like the risk to go away. We would prefer if nobody had strokes. I mean, that's really where we'd like to be in 20. I mean, we'd like to be there today, but we're not. We've got a lot of work to do. But that's kind of the ideal scenario. So if we can work to reduce this at all, I mean, any improvement will generate better outcomes for you and for your loved ones over the long run. So the effort is definitely worth it.
Yeah, and it is just, and we'll talk more, or Wendy, you'll talk more about those lifestyle habits in a little bit, but really it's small changes that make a big impact. So
yeah.
Yeah. So we have, I know you prepared some images for us. Did you want me to pull up the first one here
Yeah.
on high blood pressure? Okay, awesome.
Yeah.
So our viewers.
So this kind of dives into the high blood pressure situation a little bit. And what's really interesting, and kind of all of these risk factors that we'll go through, is they're all interrelated. So, you know, high blood pressure is related to damaging the arteries. And then, you know, if you've got diabetes in addition to high blood pressure, you know, it generates additional change and additional damage. All these things sort of work together to create kind of the perfect storm. But high blood pressure specifically, I think maybe a lot of people don't know, the guidelines changed. It's been a few years now, but normal blood pressure is now considered less than 120 over 80. That used to be sort of closer to 140 over 90, and then it moved to 130 over 80, and now it's 120 over 80. So they've slowly been sort of moving that number down, trying to get people in a much more controlled range. So if you're having consistent readings over 120 and on the top number and over 80 on that bottom number, it's really time to see, you know, to seek some help and do some things to try to get that under control. You know, when blood pressure is left unchecked, it puts you at a much higher risk for an ischemic stroke, but it also puts you at really high risk for a hemorrhagic stroke.
Oh, wow.
And the majority of hemorrhagic strokes are actually caused by just untreated high blood pressure. So the way that blood pressure damages the blood vessels is just, you kind of have to think of it like plumbing, you know, and if you've got a pipe that's not really rated for the amount of force that's going through it, which would be blood flow in the case of our blood vessels, then some damage is going to start to happen on the inside of that pipe. And so the same thing happens in our blood vessels. There's something called shearing forces. And so if you're a technical or mechanical person, you'll kind of know what that means. But with the speed and the force at which the blood's going through the blood vessel, the tissue on the inside of it's not really created to handle that kind of pressure. And over time it tears. And as the body tries to repair those tears, that's kind of when we start to see some buildup of plaque and some buildup of platelet products and things like that on the inside of the blood vessel. And it creates a narrowing, which we'll kind of see in the next picture. So if you want to go to that picture, it's actually pretty helpful to talk about all of these risk factors.
Yeah.
But on the left, you kind of see that little normal artery, and it's nice and open. There's a couple red blood cells flowing through it. Obviously, there would be more than that normally. But otherwise, it's full of plasma and platelets and, you know, immune factors and other things that are typically found in our bloodstream. But over time, you can see that the vessel on the right has actually gotten bigger. And that's not just so you can see what's inside it in the picture. That's actually what happens. So the blood vessels actually start to enlarge. The muscular layer on the inside of the vessel can get a little bit bigger, so it can narrow sometimes the size of what we call the lumen or the opening in the blood vessel. And then as those platelet products and those fatty deposits start to happen inside the blood vessel, you can see that opening or that lumen gets smaller and smaller and smaller. And so the blood has to work harder and harder and harder to get through it. So, you know, that's caused by things like high cholesterol, high blood sugar. So if you've got a lot of circulating glucose or sugar in your bloodstream from prediabetes or from diabetes, that's kind of some of the damage that's happening. And then again, with hypertension, you see the enlargement and the changing shape and just the makeup of the blood vessel. But in addition, it starts to damage that lining of the blood vessel, and then it can tear it, it can rupture it. Or, you know, like I said, in the case of these small tears, as the body starts to repair it, you see even more buildup of plaque and those platelet products. And so it just creates even more narrowing of the vessel. And then it closes. You know, at some point, blood can't get through it anymore. And that's when you have a stroke or you have a heart attack. You know, there's other things that can happen, like aneurysm, you know, formation and worsening and things like that too. So this is really, really, really important. High blood pressure is absolutely crucial. You know, it's crucial to control that risk factor because it really does a lot of damage.
Yeah, absolutely. Yeah, and thank you for the visual that you have here. I think that makes it, you know, seem, you know, a lot more sense when you actually can see the visual versus just kind of talking about it. So, yeah. And so I think we wanted to go into a little bit more of the AFib, right? We want to talk about that one.
Yeah, we can. I kind of like to go back to the other slide and
Oh,
talk a
sure.
little about, we can talk a little more about lipid control. So when we talk about things like high cholesterol, what we're really referring to is the amount of circulating fat in the bloodstream. And so when we eat, food and different types of fat, that's absorbed obviously in our GI tract, so in our stomach and intestines, and it goes into our bloodstream. And so typically it gets absorbed and excreted. But if there's a lot of it and certain types of it, then it kind of hangs around and it can deposit itself on the walls of those blood vessels. So, when we talk about folks having high cholesterol, again, really the importance of that is that we're trying to prevent those deposits that happen on the inside of the blood vessel, so we don't end up with plaques, because those plaques and deposits are what narrow the inside of that blood vessel over time. And those plaques can actually rupture. So similarly to the tears that you get, inside your blood vessel, you can actually have similar damage to those plaques. And oftentimes we'll see strokes where a piece of the plaque has broken off, a part of the plaque is still left there. You can actually see this plaque when we do CAT scans of people's blood vessels. You can see the plaque lining the vessels all the way down into the heart, so it's really impressive, and there's definitely evidence that it's there. So, when we talk about controlling that, that's really what we're after, is trying to prevent that from happening, or even to reverse it, because we've shown with newer medications and certain types of diets that we're actually able to reverse that and we call it atherosclerotic disease. But it's just, that's kind of the fancy word for the plaque buildup and fat buildup inside the blood vessel walls. So that's really what those treatment options are for. So whether it's a statin or whether it's, plant-based or a very plant-forward diet, heart-healthy diet, those things have actually been shown to be able to reverse atherosclerotic disease. So that's where all of that advice comes from.
Yeah, and that's such an important point, really, that I would like to stop at and reiterate is this can be reversed, right? You can, with healthy lifestyle choices, you can, reduce, or would you say eliminate the plaque in these arteries?
I don't know that they've been able to show that it goes to zero, but the risk reduction is very significant. So it's, you can really reduce your overall risk of stroke and heart attack. In fact, I think there's a couple of big academic centers that have started doing some research on offering plant-based diet and nutrition counseling, even while people are on the inpatient side. But studies have been consistently showing that those types of those are big dietary changes for a lot of us. A plant-based diet is far from typical, in most of our kitchens. And it's a challenge because it's new. It's a different way of eating, and that takes a lot of time and planning and effort. And then also, you obviously want to be able to enjoy the food that you're eating. And so I think people find it very challenging to sort of come to terms with the idea of adopting a diet that seems so sort of extreme. But yeah, it's been shown to actually reverse this type of disease process. And that's huge. If we could eliminate 80% of our strokes and heart attacks through diet and exercise, that's a big deal.
It is, absolutely. Yeah. So Wendy, what was the next? I think we were talking about our chronic diseases here.
So the next one would be diabetes, and we touched on this a little bit, but diabetes also causes damage of the blood vessels. It can also cause damage to the small nerves, and again, that's when blood sugars are uncontrolled. Okay, so if there's kind of a spectrum of diabetes. There's pre-diabetes, and then there's diabetes. And you and I were actually talking about this earlier. The CDC actually has a really great program, and those are offered locally, I think, through our YMCAs, and I think even Baptist has some input into that as well. But there's actually sort of a diabetes prevention program that's available to patients, and it's pretty comprehensive. So it looks at diet, it has nutritional coaching and counseling and one-on-one counseling and group meetings. But diabetes, that extra sugar that's floating around in the bloodstream is kind of similar to having extra fat floating around in the bloodstream, except it damages the blood vessel in a different way, but it still, causes damage to the inside of that vessel. And it also damages your tissues. So sugar is a little bit different in that lots of extra sugar floating around is also pretty harmful to the kidneys, and it's harmful to your nervous system. So it's really important, if you've been diagnosed with prediabetes or you're at risk for diabetes due to family history. And again, we're talking about type 2 diabetes, not type 1 diabetes, which is, there's a lot of reasons that people get type 1 diabetes, but it's not a preventable illness that we know of right now.
Yeah.
So but type 2 diabetes is probably in the same tune as stroke, 80 to 90% preventable in most patients. So again, it's sort of being in tune with your numbers. We always talk about kind of knowing your numbers and having those conversations with your physician or your provider, whether it's a nurse practitioner or a PA, but just, making sure that you're aware of what your numbers are. And in this case, it would be your fasting glucose level. And if you are diabetic, it's going to be your hemoglobin A1C along with your fasting glucose levels.
Mm-hmm.
But knowing what those are and being able to reduce them and get them into normal range, and working with an interdisciplinary team to get those under control, if it's something that you struggle with, it's super important. And again, I'm just going to keep repeating this. 80% of strokes and probably the same number of heart attacks are preventable by controlling these things like high blood pressure, high cholesterol, and diabetes.
Yeah, and I think what's wonderful about it is that it's these two things of nutrition and exercise, among others. Of course, there's some other health behaviors, stress, sleep, of course,
right.
But those can help with all of these.
All three of these, right? And they can actually prevent you from having those. And in fact, I would say in all three of those, the first step in the guidelines in terms of treating those, or once your provider has identified that you have a high lipid level or you have a high blood pressure, the first step in most cases, unless your blood pressure is like really high, but in general, if you're sort of sitting on that borderline or you're a little elevated, the first step is going to be 3 months of healthy eating and an exercise regimen. So we know that those things can be prevented or controlled with diet and with exercise. And we talk about that a lot, and we can kind of get into that a little bit at the end. But, again, it's not necessarily an all or nothing. It's just consistent steps towards increasing, fruits and vegetables, increasing whole grains in your diet, eliminating a lot of processed foods, processed meats, reducing animal fat intake. So there's some very actionable steps that you can take that you don't necessarily have to take all of them at once, right? Again, you don't have to, Rome wasn't built in a day. So it's gonna take some time and some effort. But again, being able to prevent, I think the statistic is 1 in 4 patients in the one in 4 citizens of the United States will have a stroke in their lifetime. So wow. 80% of those could be eliminated. That's huge in terms of our abilities to, spend extra years and months with our families, to continue working without being disabled. That's really big personally and to our families and to our community. And then in the long run, obviously, there's a big financial impact there in terms of, the cost of healthcare once someone's had a stroke. So both to the patient and their families, and then also to, insurance and then federal payers and people like that. So
yeah,
across the spectrum, it's helpful,
helpful for many things.
For many different reasons. But obviously the primary thing that we're after is for people's, ability to have a healthy and satisfying life and to provide for themselves and their families.
Absolutely. And Wendy, just to kind of piggyback off of, you talked about the diabetes prevention program, but also Baptist does have 7 community wellness centers that are staffed with health coaches that our community members can see for free. And it's one-on-one coaching, and these are coaches that are specially trained to help you with these lifestyle factors too. So there is some information just above us and some links if you guys are interested in looking into that. But we're also getting some comments here too. So I'd like to just kind of look at those. So it looks like Diana and Megan are tuning in with us and just are reiterating how important this education is. Diana had a question for us. She said, would you recommend completely cutting out red meat?
So I'll say that's a tough one for a lot of people, but the data actually backs that up. And so if you're willing to do it, I think that there's definitely benefit in cutting back completely. I think, again, there's definitely sort of a sliding scale in terms of what your risk is. So if you are willing to have, some people say the way that they get around this and the way they make the like no red meat more tolerable is they kind of have cheat days, right? So maybe once a week or once every 2 weeks or once a month or whatever, they'll allow themselves to have that. And that seems to satisfy a lot of people, and it kind of keeps them going, right? So it's really hard to totally, if you're a huge red meat eater, it's really hard to totally deprive yourself of it. But, I, for one, like I could probably cut it out and I'd be okay. I'd probably miss a hamburger now and then, but it's definitely backed by the data that cutting out red meat entirely is a pretty good way to go.
Yeah, absolutely. And it looks like Megan has a question for you too, Wendy. She said, do you have post-stroke recommendations? That's actually a great question.
Yeah, it is. So actually all of the stuff that we're talking about can be dealt with in terms of what we would call primary prevention for stroke, which is preventing the first stroke, but it's also really helpful for preventing the second stroke. And so historically, most health systems and hospitals have, we're kind of now getting in the primary prevention game, but most of us have really focused on what we would call the secondary prevention model because we don't necessarily come in contact with people until they've had a stroke. I think, the reorganization systems is changing that a little bit, but so speaking to your physician specific factors and how you can reduce those is really important. And I think all of this is applicable to post-stroke. And if you want to send some messages, I think if you can leave comments here, we could probably have a more in-depth conversation offline. But yeah, this is all applicable to post-stroke. And obviously in the post-stroke realm, there's going to be additional medications that are needed. And so I think when we talk about saying exercise and diet are kind of the first line therapies, that's in the event that you have not had an event. So either a cardiac event or a stroke. So with stroke and heart attack, we're gonna utilize things like aspirin and Plavix or Brilinta. We're gonna use an antiplatelet agent to help stop this immediately so that it's not gonna happen again in the very near future. So there's a pretty high risk once you've had a stroke that you're gonna have another one. So we need to do some things to sort of reduce that risk drastically in the immediate future. And then as time goes on and those risk factors are controlled, then we can sort of talk about what those mitigation strategies are. So whether we still continue to need all of those medications, but that's definitely something to walk through with your stroke neurologist or with your primary care doctor so that they can help guide you. And everybody's case is a little bit different. So I don't want to necessarily give medical advice to specific patients here, but just know that, in the immediate post-stroke period, there's going to be some medication. Statins are another one. Even if you don't necessarily have what's considered high cholesterol, you'll probably be on a statin. Those drugs have been shown to actually reduce inflammation in addition to helping to control the bad cholesterol levels pretty rapidly. So we use those. And again, it's one of those things, really trying to get that LDL down below 70 so that we're, kind of cleaning the slate, so to speak, so that you're not at risk in the immediate future of having another stroke.
Yeah.
Starting exercise after stroke, and that really is dependent on your physical capacity. So we would say if you don't have any deficits, so if you're walking fine, you don't really have any weakness in your arms and legs, and you don't have any balance issues, as long as it's safe, for you to be doing that. And I think, again, that's a conversation either with your neurologist or your physical therapist or, your primary care doc. But as long as you're safe to, walk without an assistive device, I think you're pretty good. You're pretty good to get on a treadmill. Just, obviously use your judgment and make sure that you feel safe when you're exercising. But
yeah, that was great, and great questions from our viewers too. And I love that we went over kind of the difference of primary prevention versus tertiary prevention. And Megan said, thank you for the help with that question. So that's awesome. Wendy, I guess one other issue that I was hoping that we could review is sleep apnea. If we could talk about that for a couple of minutes. I know we had a conversation in the past and I had no idea that this was a risk factor for stroke at all. So could you go over that with us?
Yeah, and if you want to scroll down to that, I think I have a graphic for that one too.
Sure. Yeah. Let me pull that up.
Sleep apnea is, it's an interesting little thing. So patients with severe sleep apnea, and there's grading scales for sleep apnea. So there's mild, moderate, and severe. But if they have severe sleep apnea, they're 4 times as likely to have a stroke. I mean, that's a huge, huge number. It's also linked to depression. It's linked to, obviously, heart disease. It's linked to cancer. It's linked to Alzheimer's. It's other, and then cognitive impairment, which is not, not as severe, but obviously definitely impacts your quality of life on a day-to-day basis. So sleep apnea it's a major health problem in the United States, and it's very, I'm not going to say fairly, it's very underrecognized, very undertreated. And it has to do with, it actually, all of those other stroke risk factors we talked about, it makes all of them worse. So if you have sleep apnea and you have high blood pressure that's really hard to control, that may be one of the reasons. So I had prepared this really cute little graphic, and of course now I don't have it because I'm not sure what happened to my PowerPoint last night. But basically with sleep apnea, what's happening is your airway is blocked, okay? So normally air goes from your nose and your mouth down through your airway and into your lungs. But in sleep apnea, the tissues in the neck, or maybe the tissues in the face and the throat, they close. And so you're not able to get the air from outside your body to inside your body. And so you basically have pauses in your breathing. And so there's a lot of things that happen when you're not breathing. So your oxygen levels drop in your bloodstream. And then there are receptors in your blood vessels and in your brain and in your kidneys and your adrenal glands that are all kind of interrelated. And there's some chemicals that get released when your oxygen levels drop. And that's a protective mechanism. So really your body's trying to take the oxygen that it has and get it to the right places so that you don't have brain damage and so you don't have heart damage. Okay, so those are going to be the 2 big, priorities. However, over time, what happens is that actually generates basically a chronic hypertensive state. So patients can actually have high blood pressure from their sleep apnea. And then it also, again, creates, these cognitive impairments. It can create a stroke on its own. Usually those are kind of the small blood vessel strokes that we see. But a lot of strokes happen in the middle of the night. A lot of strokes happen with no obvious reason. And so a couple of theories for that is that there's probably undiagnosed atrial fibrillation that we don't know about. But guess what also causes atrial fibrillation? That would be sleep apnea. So, sleep apnea is it's really linked to all of these chronic health conditions. It certainly makes them worse. And so I think, recognizing that you have it, there's a lot of denial that goes on with sleep apnea. And I think a lot of it's because patients they're not comfortable with the CPAP machine. They're used to the old ones. It's just, they don't even want to talk about it because they're not going to sleep with that machine. But, usually in my practice, what would get people to sort of be like, all right, fine, I'll go to the sleep study, was once you sort of mention that dementia is caused by these risk factors and significantly worsened by things like sleep apnea, that sort of gets people's attention. I think we all know someone who's suffered from dementia, and we've seen, the havoc that wreaks on families and patients themselves. And it's just, it's such a sad thing to watch. But knowing that there's something that you can do to kind of prevent that from happening. And certainly there's genetic links and all of those sorts of things. But sleep apnea is definitely a culprit, and not only stroke and heart disease, but in things like dementia as well. So the things that lead to sleep apnea, again, patients who've had stroke are higher risk for sleep apnea, but that's sort of a chicken and an egg situation. We don't really know if the sleep apnea caused the stroke and then we found it after the stroke. That's under investigation currently. It definitely makes high blood pressure worse. And then people who have sleep apnea are more likely to have chronic health conditions because they're all sort of caused by, similar things. So sleep apnea can be caused by anatomical variations. So some people have sort of a deviated septum, or they have, they have some issues with their tonsils or their adenoids, or, something like that that's causing the sleep apnea. And in those cases, sometimes surgery is actually indicated. And I have several friends and acquaintances that have had that surgery and done really well afterwards. But then a lot of times it's related to central obesity, and then obesity in the neck and the jaw and the face. So people with a certain neck circumference are actually predisposed to having sleep apnea. And so again, this is another situation where, diet and exercise may not quite be enough. It may actually be that there needs to be some weight loss associated with the diet and exercise to help alleviate the sleep apnea. So, and the symptoms, I mean, they're classic, right? If somebody tells you that you're snoring and you stop breathing in the middle of the night, there's a pretty good chance that sleep apnea is on the table, and at least warrants an investigation. If you're sleeping in the daytime, or you're having some memory issues in the daytime, you're having frequent headaches in the morning, or you just really don't feel like you're getting a good night's sleep, and can't really pinpoint a reason for it, then definitely a sleep study, or at least a conversation with your physician, is in order.
Yeah, and actually that goes with the question from Lauren here. She said, she asked if you recommend seeing your PCP after a stroke for sleep apnea testing.
Yeah, and I think that probably in the future will be part of sort of that post-stroke evaluation, is to make sure that you don't have sleep apnea, because it is fairly easily treated. And once you treat it, it can help with all of those risk factors. So it's not just reducing your risk for stroke, but it's kind of lowering the blood pressure. It's preventing your risk of cardiovascular disease. It's preventing the risk of sudden cardiac death during sleep. And it also can help with weight loss. So if that's something that you're working on, reducing those circulating sort of stress hormones that are caused from, that lack of oxygen will also help in your weight loss efforts often.
Yeah, absolutely. Thank you for going over that, because like I said, that really piqued my curiosity when we had talked about that last.
It's really fascinating, and you're not the only person that's sort of surprised when that statistic comes up. It's a big deal. It was actually included in the new guidelines that were just released from American Heart. When we talk about primary prevention of strokes, screening for sleep apnea is one of those. Recommendations. So,
wow, so it's even in there now. Officially. That's great. So Wendy, I know we're a little bit past our half hour, but we had a slide on nutrition. Did you want to go over that, or would you like to just review our stroke symptoms with our viewers here?
I think if we're getting that close, maybe we can leave some material for them to review. American Heart has a ton of good information. I know the Baptist and the YMCA folks also have a lot of really good information. But yeah, we can kind of go through the BFAST.
Yeah, let's do that. Yeah, absolutely. And just to talk again, reiterate, our health coaches out in the community at our different wellness centers that are located in some of our YMCAs, our Jewish Community Alliance, and at our new health place at Nocatee, they actually have these stroke risk scorecards on site. So you can meet with the health coach. They're happy to come in and see you and just review these with you, as well as any lifestyle changes that you're hoping to make. They can help you with that. So just to kind of reiterate. But these were the risk factors. Let's review that BFAST.
Great. So BFAST, American Heart adopted FAST a long time ago, and then a lot of us felt like strokes have different symptoms based on the artery that gets blocked. And there's quite a few arteries that supply your brain with blood. So don't say that 3 times really fast. But what we sort of realized was that there was something that people weren't picking up on, and it was sort of these strokes that are happening in the backside of your brain. And so we added the B to it. And a lot of other hospitals have done this as well, but basically recognizing that sudden vision loss is always a medical emergency, and that any sudden change in your balance or coordination is also, could be indicative of a stroke. So we include the balance, and so B is for balance. And I'll say the whole BFAST mnemonic really is trying to get you to recognize the symptoms and then seek treatment as quickly as possible. And we always recommend calling 911. Not all hospitals are the same, and they're not all equipped to handle complex stroke cases. So it's really important to let paramedics and EMTs sort of guide that decision-making for you. Obviously here at Baptist, we have, the downtown campus is a comprehensive stroke center. The rest of them are certified, but the downtown campus is the only one that provides thrombectomy, that can retrieve that blood clot. So we've got a system of care in place to get you where you need to go. So, you'll be covered, but we just want to make sure people understand that stroke is always a medical emergency. It's never not a medical emergency. And you need to be fast. So the symptoms are in be fast, and you need to call 911 immediately with any sign of stroke. It can be just one. It doesn't have to be a combination. It doesn't have to be all of them. But if you have just one, it's time to seek help right away. Don't take a nap and see if it goes away. Don't chalk it up to a migraine, or you don't feel good. Like, a stroke is a stroke. These aren't warning signs. These are symptoms of a stroke, and it's happening. Even if they go away, I always have to throw this caveat in there. If you have a weak arm, or all of a sudden you can't talk, but it goes away in 2 or 3 or 4 or 5 minutes, you still need to get treatment, because there could be a blocked artery, and it's just kind of a matter of an hour or two before it blocks off again. So we'll go through these. So B for balance. If you have sudden loss of balance or coordination. So I had a patient one time that told me they were at dinner and they reached for their cup of tea and they just couldn't get it. Like, they could see it, but they could not get their hand to meet the cup, and they couldn't figure out what was going on. And finally, somebody kind of recognized there were some other symptoms that the patient didn't fully recognize that they had. I think they had some facial weakness, but the patient just knew they couldn't reach their cup, and so they said, "Hey, something's wrong." And then the family realized what was going on, and they called 911. Oftentimes we get complaints that are not complaints, but we get a report that sometimes, people were at a party and they were fine, and then all of a sudden they looked like they were really drunk, right? So it wasn't sort of a progressive thing, but they started stumbling, or they couldn't stand upright, or they went to sit down and they kind of fell out of their chair. Their coordination's shot, So if that happens suddenly, that is definitely the sign that something is wrong. Eyes. So eyes, again, that's vision, right? And so oftentimes patients don't know that they're missing their visual fields. There's a weird thing that happens to your brain, and you don't really realize that something's wrong. Sometimes people do. I mean, we've had patients that said, like, I was reading and realized I couldn't see all of the words. Like, I'd been reading and it was fine, and then all of a sudden half the words were gone, or half the page was gone. So, but again, any sudden loss of vision is a medical emergency, whether it's a stroke or not. So it's always a good idea to get seen immediately for any vision loss, or even sudden double vision. For face, this is kind of where we look for that facial droop. And, if there's a sudden change in the ability of somebody to move, you ask them to smile, and if only one half of their face moves, or one half of their face moves normally, then that's facial weakness. And that's usually comes along with some other symptoms, but not always. So that would be a sign to seek help immediately. Arms, this is again where we ask people to hold their arms out to see if one arm is weaker than the other. So if you ask them to hold their arms out and close their eyes, if one of their arms doesn't stay up with the other one, or if it drops on its own, then that's arm weakness. That's a significant finding, and that also warrants a 911 call. And speech, this is a big one. So if you're talking to somebody and all of a sudden their words sound totally out of left field and they seem super confused, or, especially if you were just talking to them and now their words don't really make sense, or their speech is really slurred, or they can't speak at all, or maybe they keep sort of saying the same thing over. You ask them what day is today and they say yes. And then you say, what color is my shirt? And they say yes. Obviously they're able to engage in dialogue with you, but they can't produce the correct speech. They can't get the right words out. So that's what we would call aphasia, and that is absolutely a sign of stroke. So T doesn't really stand for anything but time. It just means call 911. Don't wait, don't pass go and collect your $200. This is get an ambulance right now. And it's important to know that ambulances will go everywhere. So, there are some patients who think that the ambulance won't come to their house, but they will. And I promise you, they don't care what your house looks like inside. They've seen it all. So don't be embarrassed. Don't be afraid to call. We're really here to help. And we have teams waiting. We don't want this to happen to anybody, but we do want you to get treatment as quickly as possible, because the worst thing in the world is to see someone who's come in and they have what would have been, a stroke that we could have fixed, but it's too late for us to fix it. And so that's, I've been around long enough to see it kind of not be treatable, and now it is treatable. And again, it's kind of a dagger to the heart to see people come in too late to be treated, because time is, time is really the only factor that we have control over.
Mm-hmm.
We can go in and grab that clot and pull it out, but if the damage is already done, it's already done. And then our procedure only puts you at risk for complications at that point. So we need to see you as fast as humanly possible.
Yeah, and to reiterate something that Marjorie and I went over last week, time is brain, right, Wendy? Yeah. Time is brain. So
that is definitely the saying. And it's a lot. I mean, it's like, I can't even remember the number, something like 2 billion neurons a minute that die in a stroke. And so, you wouldn't imagine that you have that many, but you really do. And so every minute really truly counts. And so, we see people all the time. They'll be like, oh, I just want to take a nap. It'll be okay. I mean, I had a lady one time that came into the office and she had dragging her left leg. She couldn't walk. And she's like, oh, it's been like that for 3 days. I figured I'd give it another day or two. And if it didn't go away, then I'd, call my doctor. And I'm like, nope. I sent her to the emergency room, obviously. But at that point, it's too late to do anything.
Yeah, definitely. Yeah. So really, this is to just, make sure everyone is educated on all of these risk factors and making sure if it's stroke is not something to, just put to the side. It's something, if you see any of these symptoms, you act as soon as possible. So.
And you may, yes, absolutely. And you may have to act on behalf of a family member that sort of refuses to get treatment. Yeah. It's really important to just, be like, listen, I know what the signs of stroke are. We're going to go to the hospital. I know you don't want to go, but we're going.
Yeah, I mean? Absolutely. So. You have to yank them out of the door sometimes. Yeah. Well, Wendy, I just want to thank you so much for your time today. This was just so informational, and I hope that our viewers took a lot out from it. I know I did, and just that reiteration of all of these things. And to remind everyone that next week is our third part of our stroke awareness series. We'll have Christy Sawyer out with us, and she's going to be talking about aneurysms, which I know, Wendy, you talked a little bit about today, but then also what to expect when you come to the hospital. So definitely tune in with us. It's next Monday at 1 p.m. And I just want to again thank you everyone for joining us, and Wendy for your time. I hope you all have a wonderful afternoon.
Thank you. Thank you.
Bye, everyone.